A blank canvas can be intimidating.
They say art imitates life.
Trust the process, sort of relax.
Choose
Maybe a little white.
any colors you want.
Maybe a lot of white.
If only life
I worry about it every day.
were that easy.
And I was 30 when I had my mastectomy, and I was pretty young for it.
Yes, it was precancerous on both sides.
I used to have panic attacks in the parking lot every time before I would go in for an MRI.
Since 2010, Erin Kirkby's life has been colored in fear and anxiety.
I thought, every day, is today going to be the day? Is today going to be the MRI that I'm going to go in and they're going to tell me that they found something?
Nearly every hue of cancer has hit her family.
My mom was battling breast cancer for the second time, and at the same time, my uncle, her brother, was in treatment for pancreatic cancer.
It was no surprise when she tested positive for the BRCA mutation, increasing her risk of ovarian cancer from less than 2% to up to 70%, and breast cancer from 12% to up to 80%.
For a minute, I was just completely numb to it, and then I had to go talk to a doctor, and after I left his office, I just burst into tears.
For women with the gene, cancer is not a matter of if, but when.
I thought it was completely over. I thought my life was going to be completely different than what I had planned.
That's been a lot of coping and a lot of counseling.
I had all these things that I wanted to do. I wanted to get married and have kids someday.
My anxiety, like you were saying, was so enormous before the surgery that I broke a cast iron skillet in half.
Sisters,
I banged it on the counter a couple million times.
Amy and Jody,
Because it sounded good. It sounded like what I was feeling.
know that feeling all too well.
So, yeah, it's rough.
Constant worry, 2 biopsies that, quite frankly, for me in some ways were worse than the surgery.
I wasn't surprised.
A rare gene.
I wasn't prepared.
Only 1 in about 400 to 800 women have a genetic mutation. Often, the best treatment is prevention, removing ovaries and undergoing mastectomies before cancer has a chance to set in. Jody, Amy, and Erin all removed their breasts
We did the bye-bye boobie party, the whole bit.
within the last year.
No regrets, right?
The gene is so rare that women often feel alone in the journey.
This is actually the first time I've ever met anybody else that had BRCA mutation.
There's a reason I invited this group to meet.
It's never skipped anyone in my family.
I'm on that same journey.
My mom, when she was 34, which is how old I am now, and she had advanced stage 3, and it was the size of a grapefruit.
Like Jody, Amy, and Erin, fear and anxiety have colored my life since my test was positive in 2008.
The relief that I felt, even after I remember waking up from surgery, was just incredible. I felt like I was breathing for the first time.
Decisions many never dream of making.
You have the remarkable opportunity to change your destiny.
Knowledge we're lucky to have.
I had to turn that around from this is a curse to this is a gift.
A gift we never wanted.
But it is.
One that empowers us.
After I had it done, it really just confirmed for me that I made the right decision.
Lives no longer colored in fear.
It's very peaceful.
That's what I was going for. Use a little peace in my life.
But brushed with a whole new color.
It's boobs.
Of hope.
If I can help one 23-year-old, to know what her options are and to know that it's not the end of the world, I feel good about that. Well, you have good days ahead.
It was the thing in my life that I was the most afraid of.
Sometimes life gives you the opportunity to test your strength.
And the thing in my life that it took me 6 years and lots of counseling to be able to even pull the trigger on.
Whether you like it or not.
The grief and the guilt and the why me and, all that stuff.
At 48 years old, Amy Childers never thought she'd be learning to fly.
Yes. Go.
In this season of life, there are a lot of things she didn't expect.
I mean, anything that has to do with cancer, right, really makes you sit down and reevaluate what's important. It's this wake-up call.
6 months ago, Childers underwent a bilateral mastectomy.
It feels really good to move.
It was preventative.
Getting myself to the point of doing the surgeries was just an exercise in bootstrap courage, you know, doing what had to be done when you don't want to do it and you're dreading doing it.
A surgery many women with a genetic disposition to breast cancer, like Childers, are now turning to.
This is not a death sentence for your breast. This is not a death sentence for you as a person, as a woman. This is the beginning of a different journey.
Dr. Justin Sachs, the director of reconstructive oncology for Johns Hopkins, has dedicated his life to not just making women feel whole again, but making them stronger, giving them options to thrive.
It's just something that's a newer technique here that I've adopted, a few other surgeons have adopted.
He's who I turned to.
Progressed really well, you're done with your expansion.
When it was time for my preventative double mastectomy.
You're a young parent working. Why do you need to have breast cancer in 10 years? Why? There's no reason. Not in 2017. You can get a test that will give you a prediction with percentages.
9 years.
A gamble I came to realize in 2008.
I didn't sleep like hardly at all last night.
When I tested positive for the Brca mutation.
It's weird to have it finally be here.
After all, my mother, aunt, and grandmother all had battles with breast cancer.
That is a pattern, a family history pattern of higher penetrance. And so I would put you in the 70 to 80% range.
We'll see you inside.
Also a little bit earlier onset than some other people. And so that's why I was very supportive of your decision that this is the time I need to do this.
To reduce my risk of ovarian cancer, I had my ovaries removed 2 years ago.
You are feeling a time pressure.
Doing whatever I can to decrease my odds.
The family experience has so much to do with the decision to do risk-reducing surgery.
Mastectomy was the next step.
Patients who had especially a bad experience with breast cancer in the family, and that kind of pushes this, like, yeah, we're doing this.
But this surgery is vastly different than the radical, life-saving one my mom had 25 years ago. 20
years ago, we did these big mastectomies and put these big scars on the women's chests, and I always felt like there's got to be, you know, it's a better way to do this.
It doesn't look as jarring as what I expected.
One of the biggest advancements in reconstruction has happened in the last 2 years.
I'll place an expander on top of the muscle with the use of that biological tissue, and then we begin the process of restoring the volume of the breast. And you're not really stretching out the muscle, which is the big problem with pain.
Yeah, I think there might be a little more fluid in there.
Restoring the volume is a process that lasts several months.
I would expand both sides, put in 100 maybe on each side.
But the new technique allows women to recover faster.
You know, she sent me a picture of her, you know, she's like this. And this doesn't happen 5 years ago, a month out, doing yoga.
Women want to be rebuilt and put back together, but they also want to go back to doing what they were doing. And that's what's so astounding about this technique.
For some, it's an opportunity to do even more than before.
I walked back there and climbed up onto that table by myself.
This isn't just about learning to fly.
If I could do that, I can do anything that I set my mind to.
It's an unexpected season.
Girl, you can do anything now, right?
Of strength.